Thank you for the wonderful talk, Dr. Tsatsakis. So the next speaker is Professor Aristidis Tsatsakis. Sorry for my, I didn't speak much of the, learn much of the Latin. So Professor Tsatsakis is a World Academy academicians from Europe, and also a member of also Russian Foreign Academy. His work is going to discuss the area where this is really related to the toxins. The toxins is everywhere, and obviously it's in plant, animal, and human. And so he's won many, many awards from the Eurotox organization. And so without further ado, I'd like to invite. Okay. So thank you. All right.
Thank you. I want to thank you, the organizers, for inviting me here. I'm very pleased to be in China. It is my fourth time, and I think this time will be more effective and more productive because I am at the right place, probably in the right time. So, what I will talk today, and you know, I had a bunch of slides that are above this time of 20 minutes, but I have to shorten the slides for 15 minutes. So from the beginning, because you have a translation in Chinese, I will pass some slides, and in the beginning I will start with the most important thing that I will present here. So my presentation relates to some issue that is very well connected with the previous speaker. The previous speakers talk about methylation in DNA as a biomarker also of aging. And as you understand, there are a lot of methods and techniques and studies to evaluate aging. So methylation is one very well appreciated method, as Moshe discussed a few minutes ago. And now I will present another one that is related with the telomeres that are the end of the chromosomes, that are the sequences that protect chromosomes from aging. So why this is important for traditional Chinese medicine? So I will pass the slides. So why? In the previous slides, it was just a few words about me and what I do. So I am a toxicologist. I have a big network all over the world, starting from New York to Korea. So, and in my very recent studies, I developed this real-life risk simulation concept. This is my concept in toxicology. And this concept is related with what actually we are now talking about, real life. And from my point, real life risks. And what are real life risks? It is related with low doses, combination of many chemicals, multiply routes of exposure. And why this is important? Because everything we consider safe nowadays, it is supported by studies that are done for the single compounds. So all we consider safe, it is based on single evaluations, single testing. So all these studies that are related with safety all over the world, by EFSA, by ECHA, by FDA, they consider the single compounds. So the regulatory practices currently in force overlook all this what I wrote, early signs of adversity, the potential of non-monotonicity. Actually, they neglect real life exposures. So for this, I started maybe 15 years ago some tests and laboratory tests and evaluations in order to prove this concept of, and I will not go in details, the concept was proved and showed that even we started to test a combination of chemicals at low doses, we see some effects that were related with non-safety in different organisms. This was published in many journals. So after doing this proof for the real life risk concept, I had a doctor, an invitation from a doctor in Athens who did metabolomic medicine. What does it mean? He had patients with autoimmune diseases and chronic diseases, and he looked to treat the patients with doing metabolomic analysis on organic acids and fatty acids to try to optimize the biochemical profile. And he asked for me to develop the telomere test in order to use this test as a supplement with his metabolic profile testing. So this actually, now I cannot go in all details, but telomere testing actually is a general biomarker of exposomics. So it is a general biomarker of effect that somehow accumulates all the effect from all kinds of exposures in our genetic profile. And it is metabolomic, as I say. Why? Because it changes, this profile changes over the time. So you can do it after 6 months, and you will have another profile for the telomeres. Okay? So now I will go shortly in some other aspects related to the telomere testing. This is about telomeres. I will not go in details, you know. So the telomere profile is associated, as proven, with several diseases, as here cardiovascular, all kinds of nowadays most important diseases. So what is important? For us, important is not the mean telomere length, but the percentage of short telomeres, not the average telomere length. That's why yesterday in an interview, when we talk in a group, I told them that not all telomere testing are of enough value to evaluate the condition or the status of a examinee or a patient. So what is important is some parameters of this telomere testing that are done in an appropriate methodology, and this one is that one that I use, and I will show. So this is just a slide showing the rate of shortening of the telomeres during aging. So telomere shortening is associated, as I say, with many diseases and is related with all these parameters that are here. Of course, aging, but also the diseases. Here, are some reports from the literature and from my studies that we show that telomere length as a biomarker is related with, for example, obesity or diabetes or neurodegenerative diseases. I will not go now in details. And also, we have shown that this is the second part that connects me with this conference. We have shown that some good nutraceutical could help the reverse of the telomere length shortening. And this we show in this study. Actually, in this study, we use as a supplementation a mixture that contains Centinella asiatica. So we also have used this testing as a biomarker for several diseases, for example, cancer. And for example, in this case, for children with acute lymphoblastic leukemia, and also for colon cancer. Also, there are studies that we review related reproduction with telomere test shortening. And what is important, that telomere length is related very tense with lifestyle, and that, for example, exercise is also associated with telomere length, but in general, with all our lifestyle. So the impact of exercise on telomere length, and here is another study that shows that drug abusers have less shortening of the telomere length. So it means that abuse is not good for the telomere length. So this is something related with our diet, and I will, this is from my book, Toxicology Risk Assessment, and relates our diet, minerals, supplementation, and for example, omega or other, or positive supplementation, good supplementation, and telomere length. And here is another study that is related with telomerase activation, telomerase activation with telomerase activators, and this is the second parameter that connect me with this meeting, where I can say that the supplements that are related with traditional Chinese medicine can be evaluated with the use of this methodology of telomere in a population study. And here now, this is the several methods that can be used for telomere testing, and not all of these methods can be useful, as the one I use. The one I use is the metaphase Q-FISH. So I will not go with the methods. And this is the report from the a kind of the report that we get from our telomere testing. It's how looks the report. So we report a lot of parameters that I cannot now discuss, but one of the main parameters is the biological age, as was shown with the methylation method described by my colleague the previous lecture. So this is from ancient Greek philosophy, and thank you for your attention. Thank you. So as Hippocrates said, let's the food be our medicine, and the medicine is our food. So thank you.